So, Fenofibrate. It's a commonly prescribed medication for lipid disorders like high triglycerides. Um, it's a part of the fibrate drug class and is known for improving lipid profiles by lowering triglycerides and increasing HDL cholesterol. Clinically, fenofibrate is important because very high triglyceride levels not only contribute to cardiovascular risks, but can also lead to acute pancreatitis, which is why this medication is normally used when lifestyle changes or statins alone are just not enough. In our case example, my friend's father takes fenofibrate to help manage his cholesterol levels, which shows how this drug is used in everyday patient care. In our presentation here, we'll briefly introduce what fenofibrate is and explore its pharmacokinetics, like how the body absorbs it, metabolizes, and eliminates it. And we'll also cover its pharmacodynamics, focusing on its activation of PPAR alpha receptor, which drives its lipid-lowering effects. And we'll review its clinical uses, its side effects, and its alternative therapies. Overall, fenofibrate is a great example of how understanding the drug's mechanisms helps guide safer and a more effective treatment of dyslipidemia.
So let us have a look at the reasons why fenofibrate is taken. Primarily, it is prescribed to lower elevated triglyceride levels, which can disrupt the normal lipid balance. Bringing triglycerides lower helps restore a healthier metabolic state. The medication not only reduces triglycerides but also provides improvements in LDL and HDL levels, which leads to a more balanced lipid profile and long-term cardiovascular health. Additionally, abnormal lipid levels contribute to plaque formation and inflammation within the blood vessels. By correcting these lipid abnormalities, fenofibrate helps reduce the overall risk of cardiovascular disease. So, maintaining controlled lipid levels is essential for preventing heart and metabolic complications. Fenofibrate supports this by providing consistent and long term improvement in lipid regulation. So now let's learn how fenofibrate works inside the body, meaning its mechanism. Soon after fenofibrate is absorbed, it's converted to its active form, fenofibric acid. This active metabolite binds to nuclear receptor PPAR alpha in the liver and muscle, essentially switching on pathways responsible for lipid regulation. Once activated, PPAR alpha pairs with another receptor RXR and binds to specific DNA sequences called PPAR response elements. This DNA level interaction changes the transcription of several genes that control triglyceride metabolism, fatty acid handling, and lipid transport. Following these gene changes, PPR increases the production of lipoprotein lipase, the key enzyme that breaks down triglycerides. At the same time, it suppresses APOC3. APOC3, also known as apolipoprotein C3, is a protein that inhibits triglyceride breakdown. Suppressing it allows triglyceride clearance from the blood to occur more efficiently. Additionally, fenofibrate also stimulates enzymes involved in mitochondrial and peroxisomal beta oxidation. This means more fatty acids are broken down for energy and reducing the pool of fatty acids available for liver to convert to triglycerides and VLDL particles. As triglyceride breakdown increases, circulating triglycerides and VLDL levels fall significantly. At the same time, fenofibrate produces a modest rise in HDL cholesterol by increasing the synthesis of apolipoprotein A1 and 2, which are essential components of HDL particles. Lastly, PPR alpha also influences genes related to inflammation and endothelial function. This leads to reduced inflammatory markers and improved stability of blood vessel walls, contributing to a less atherogenic and more protective vascular environment. Taken together, these mechanisms result in a substantial reduction in triglyceride-rich lipoproteins, a modest improvement in HDL, and a decrease in lipid-mediated vascular risk. Overall, fenofibrate helps restore healthier lipid homeostasis and provides long-term cardiometabolic protection.
Alright, so on this slide I'm going to explain about pharmacokinetics of fenofibrates, focusing on the absorption and distribution. So first of all, let's start with absorption. So fenofibrate is taken orally, showing that has to be absorbed through the gastrointestinal tract. And this drug is highly lipophilic, which helps it to cross cell membrane more easily and reach to its target site and target organ. After absorption, fenofibrate is rapidly converted to its active metabolites and active form known as fenofibric acid. After being absorbed, the fenofibric acid has to be distributed inside the body. And this distribution occurs because fenofibric acid is highly bound to plasma protein, especially albumin. And being bound to albumin and plasma protein allows it to be widely distributed inside the body, especially to the liver area, which has its main target effect and major site of action. So, however, this high being bound to plasma protein has a side effect which can increase the risk of drug to drug interaction. So, it has to be given by caution. So, at ending, the overall fenofibrate is well absorbed orally and also can be distributed through the body and have a strong binding of plasma proteins. Alright, so now I'm going to continue about the pharmacokinetics of fenofibrate, but more focusing on metabolism, half-life, and elimination. So first let's start with metabolism. Fenofibrate acts as a prodrug. So after being administered, it has to be hydrolyzed with esterases to its active form, known as fenofibric acid. This conversion to fenofibric acid is not heavily reliant on cytochrome P450 enzymes, so it reduces the chance of cytochrome P450 mediated drug interactions. Next is half-life. The half-life for fenofibric acid is around 20 hours, which is relatively high for a drug, so it can be administered once daily. And finally, we reach to elimination. Elimination of the fenofibric acid is through kidney and through urine after being glucuronation and after it become conjugated through glucuronation. So we understand that fenofibrate has to be converted to fenofibric acid in order to have its effect. It has relatively a long, around 20 hours of half-life, and its elimination is through urine and kidney.
So now I'll talk about the side effects of fenofibrate. The most common side effects are mild and include gastrointestinal symptoms such as nausea, stomach discomfort, and diarrhea. Some patients may also experience headache or muscle pain. However, more serious side effects, although rare, are important to monitor. These include muscle toxicity such as myopathy, or in severe cases, rhabdomyolysis, especially when fenofibrate is combined with statins. Fenofibrate can also affect liver function, so liver enzymes should be monitored regularly. Next, I'll talk about the alternatives to fenofibrate in managing dyslipidemia. One of the most commonly used alternatives is statins, which are considered first line therapy. They're especially effective in lowering LDL cholesterol and reducing overall cardiovascular risk. Another option is omega 3 fatty acids, which are useful in lowering triglyceride levels. Niacin, also known as vitamin B3, can increase HDL and reduce triglycerides, but its use is limited due to side effects such as flushing and liver toxicity. Finally, lifestyle medications play a key role. A healthy diet, regular exercise, and weight management can significantly improve lipid levels and may reduce the need for medication in some patients.
So, to conclude, fenofibrate is a fibrate class medication that's important for managing dyslipidemia, especially for patients with high levels of triglyceride. By activating the PPAR alpha receptor, it improves lipid metabolism by lowering triglycerides and VLDL while increasing HDL cholesterol. Its pharmacokinetic profile, which includes conversion to the active metabolite fenofibric acid and relatively long half-life, allows for convenient once-a-day dosing. And monitoring is important because of its potential side effects and drug interactions, especially when it's used with statins. So overall, fenofibrate demonstrates how understanding pharmacokinetics and pharmacodynamics helps guide safer and more effective treatment, which reduces any cardiometabolic risks.